Hey everybody, this is Nursing Camp with Boot Camp, Primary Assessment, Part 2. You should have seen the first part of the primary assessment where I go over the specifics of this assessment. Part 2 is the conversation that you'll have with your patient when you're talking to your patient about their primary care. It's very important to have a model of conversation that you keep it focused on the primary assessment when you're doing your assessment. So it keeps you focused. I mean, it's very difficult in the very beginning because you're learning the act of doing an assessment. So in the beginning, it's going to be hard to memorize a lot of this stuff, but we're going to get into it slowly and we're just going to build on it. And then you just practice what you'll be, how you'll be conversing with the patient. So let's get into the art of nursing, the flow of conversation. All right, in the previous video, we talked about primary assessment. This is the primary assessment that you're doing where you're collecting information about your patient. That was the physical assessment that you're actually going through with the vital signs machine, the stethoscope, and getting all your data from the patient by a physical assessment. What we're going to talk about now is the conversation that you're having when you're gathering data with the patient. So it's enhancing the assessment that you already have. And this is called SHAMLD. And SHAMLDC 3 is a method that we use to gather data on the patient. So I'm going to walk through this assessment with this specific topics. And the first one is SHAMLDC is just a mnemonic, just to memorize what you're going to ask. The S stands for statistics. That's the data about the patient. Important information that you would want to know as you're doing your assessment. H is their past medical history. That's broken down into CPRI. That's cardiac, pulmonary, renal, and infections. A is assessment. It's the current patient status. How have they been feeling? M is medications. What meds are they on? And that's called Cripple IV. We'll cover that when we get to that section. L is labs, laboratory data, blood work. And then D is diagnostic, like testings or procedures. And C is consults. Other medical specialties working with the patient on the admission, not the primary physician, somebody else. So at the bottom of this, you're going to see an S. And that says assessment question cues based on SHAMLD. And then what you do is that as we move through, I'm going to now look at that area with the assessment. So let's get into it. So the first things first is like you introduce yourself, right? We said that you tell them who you are. You tell them the title. I'm a nursing student. I'm with XYZ. Or, but the first thing is the assessment is what position are they in? And we talked about that in a previous lecture. And that was part 1. And then we introduce ourselves. My name is whomever. And then you consent, right? Would you mind if I did my vital signs and assessment on you? And this is when we're going to focus more on the conversation that you're having. The physical assessment can be very nerve-wracking. So it's important to start to, work on your flow, work on the memorization of that assessment. The more that you memorize it, the easier it is to start talking to the patient about and gathering more data and working on their future assessment. So we'll move to the next part. So S on the very bottom. So the first part of the assessment is pulse. And so a question that you might ask is, the S is the statistics. What brought you into the hospital? Do you have any allergies? Now you're including that patient into their care. Like, what's going on with them? What is their history? What brought them into the hospital? You would want to know that because you're doing their assessment with them. Also, you're just kind of validating any allergies they might have, because you're going to be passing medications with this patient. So you'd want to know right away any allergies of medications that they have. Then we move on to the next part. H, we move right from SHAMLD. S, statistics. H, history. And then we do what's called CPRI. C, do you have a cardiac history? Any pulmonary history? Are you a diabetic? Or have you had any recent infections? These are questions looking at their primary medical history. This is the H portion of SHAMLD, of history. So, S is statistics, H is history. Now, these questions might carry over to other parts of the assessment. So as we move on, you can see you still have the same questions there. So all you're doing is basically asking these questions as you're moving through the assessment, so that you can just say, okay, well, CPRI, I'll ask them about a cardiac history, pulmonary history, are they a diabetic? You could ask them their last blood sugar if they are diabetic, and any recent infections. And so you kind of trail these, so you'll see that those questions are in these areas up here, P, E, P, P. So you're just making sure you follow these things. And then as we move forward, we still have the same questions, because that might be a little bit long conversations, and you can further explore with the patient about what they might be, their past medical history. Those are the primary things that we tend to want to know, is cardiac, pulmonary, diabetic, and infections. You can ask them other history, any previous surgeries or any other, thyroid issues or anything like that. That's up to you. But the primary things are CPRI. Why? Those are the most likely issues that a patient would be complicated, have comorbidities within the hospital, and results of admission. So keep on moving through cardiac history, pulmonary, diabetic, recent infections, and we do this pretty much through our cardiovascular assessment, because at this point we're going to move to the next part of the apical. So now this is where we put on our ears of our blood pressure of our blood pressure stethoscope, and we're not listening to the patient right now, because we're going to be listening to their heart, and we're going to be listening for that heart sounds for 1 whole minute. And when we're listening to those heart sounds, we're not listening to the patient at that point, because we are listening to the patient in our physical assessment. So prior to doing that, I generally will ask the patient, do you mind if I listen to your heart? It's a consent thing, because patients are very different, male versus female. And when you're listening to their heart, it might be on a woman's breasts underneath, so that's a very personal area. So you just want to consent and ask, do you mind if I listen to your heart? And they probably they know where their heart is, and they probably had an assessment before. But generally you want to ask them about that before you just go in and just start listening to their heart, because you're going to be there for a minute. Next, you're going to check their blood pressure. So before we press the button, we're going to say, how's your blood pressure been running? And because you're kind of seeing where they're at, right? And then you press the button, and then you might be asking them, you on any cardiac medications? Now we're moving towards the M of SHAMLD. So the S was the statistics, the H was the history, the A is the assessment, and then M is the medications, and that's called cripple. C for cardiac, and then that's our first questions. We're doing a blood pressure, so let's ask them about some cardiac meds. We'll ask them about how their blood pressure's been running, and are you on any cardiac meds? Then we move to the next one. C, P, cripple. CRIPL, renal meds. The R. Are you on any insulin? Are you on any oral diabetic medications? Okay, so now we're moving through our assessment. We're still in the cardiovascular, but the first question was the C, right? Are you on any cardiac medications? Are you on any blood pressure pills? Then R. Are you on any insulin? If they're on insulin, what was your last blood sugar? Do you know? What do you normally run? Are you on an oral diabetic medications? How have you been eating? So that's the R of cripple. Now we move over to the P in the cripple. As we move to the pulse ox, we place the pulse ox on their finger, and we say, hey, not hey, are you on any pulmonary meds? Or are you getting any respiratory treatments? This would either be yes or no, but it would give you an idea of like when you're going in for lung sounds to assess them. And you're asking them about their pulmonary meds and just whether or not they're getting treatments, because that's important to know, especially if they're getting treatments, because you're about to assess their lungs at this point. And so we are on the PO of the assessment. Then consent again. Do you mind if I listen to your lungs? And then you go listen to your lungs, because again, you're going to be in these kind of personal areas, especially if it's a woman or something like that, and you're a male, or or you're a female, and you just feel uncomfortable about that, So you want to ask them, hey, do you mind if I listen to your lungs? And then you question before you go, how have you been breathing? And then try to gather more data. Then the next step is, are you in any pain? So you assess on a 0 to 10. And then, do you have any other questions about your medications you're getting? Because they might have questions, and it's important to start to assess what's their understanding of what those medications are. So it's also considering that you're asking about pain at the same time, and it's also exploring with the patient a little bit. So we're still in the medications part of cripple, but that's just filling out the last parts. Then you ask them, can I sit you up and listen to your lung sounds? If they're not in pain, then you sit them up. If they are in pain, you make the assessment on whether they could sit up or not. Okay, so now here we are. We're moving towards the L and the D. And the L and the D is labs and diagnostics. So I'm going to be listening to lung sounds. I might be listening to them for up to a minute. And I might ask them, before I set them up, did you have any lab work today? So SHAMLD, right? So S, statistics, H, history, A, assessment, M, meds, L, labs. Did you have any lab work done today? Do you have any questions about your labs? D, diagnostics. Did you go anywhere off the floor? Or did you have any procedures? Do you have any questions about them? So what you're really doing is you're evaluating their understanding of their care, whether or not they had lab work today, whether they have questions about it, or did they go off the floor and they're questioning, why did I go off the floor? I don't know what's going on, all those type of things. You want to ask them, first of all, assess whether or not they had that, and then second thing is that you're asking them whether or not they have questions about that. You might not know the information, and you might not know the answers to that. So the correct response would be, I don't know, but I'll check it out for you. Or I'll notify your doctor. Or I'll notify your provider. Would you like me to get your provider to talk to you about your procedures? And so on. But generally, most nurses can't field the questions on those as you gain more experience. So we move on to the next thing. Do you mind if I take your temp, right? You're going to be shoving something into somebody's mouth. So we ask them, do you mind if I take your temp? And we'll assess the skin quality and general appearance when we're doing this. And because remember, they're not going to be talking to us while the temperature is in their mouth. And then the last portion is C, consults. Okay? During the consults section, you say, did any other people come see you other than your doctor? Did you have any questions about that? Is there anything I can help you with? Or help you answer any questions for you? So we do this generally, we ask some questions before we check their bowel sounds, and then after the bowel sounds. So generally we'll ask the patient, can I listen to your bowel sounds? And because it is a very private spot down in their lower abdomen, so we generally will ask them for consent again. Would you mind if I listen to your bowel sounds? And then we might ask them before, did any other doctors come see you other than your doctors? Like somebody who's consulted. So we're on the C part of it, consultation. And do you have any questions about that? And then before you finish up your assessment, is there anything I can get you or help answer any questions for you? And that concludes the art of this primary assessment on having a conversation with your patient. So it's very important to have something that you're saying to the patient based on the SHAMLDC. And that's basically all the information that you need to know. These are assessment question cues that are based on this mnemonic. So it keeps you in a focus on what you should be saying. Now, it's a little bit, like I said, it's difficult in the very beginning, but as time gets better, you get better at your assessment. You'll get more in the motions of doing your assessments in a proper way that you will no longer need to be thinking about it as much, and then you'll start working on your conversation and questions that you're going to be doing. Remember to ask for consent of the patient, like especially if you're going to be touching them and those type of things. And is that, you're just asking them, listen, can I listen to your lung sounds? Can I listen to your heart rate? Can I listen to your bowel sounds? Can I, before I pick you up, are you in any pain? Can I listen to your back? The more that you have their consent, the more you build a trust with that patient. And that's the model of SHAMLDC. Later on, we'll focus on SHAMLDC as far as giving reports to other nurses and how we focus this. And as you develop in your practice, we'll continually expand on this SHAMLDC. Your job right now is just to memorize. Memorize the content, memorize the mnemonics, and then go from there. And then what we'll do is we'll continually build on this concept. Well, that's about it. My name is Kevin with nursingkamp.com, and this was Assessment Bootcamp Part 2. The next video will be focusing more, breaking down the assessments and looking at the abnormals within the assessment and the normals and the comparison of each one. All right, we'll see you next time. Nurse on.